Thank you, Chairman Welch. Good to be with all of you. I know we've talked a fair amount about drug ads. Obviously, like everybody else, I see a lot of them on my television. As best I can tell, they provide the public no healthcare value whatsoever. They provide sales and marketing value for the companies that are paying for the ads. And as best I can tell, what the marketing strategy is to convince everybody that all these drugs are a cure for loneliness. I don't know if you've noticed, but the person always starts off alone, and then they tell you about the drug, and then they're with friends, or they're, instead of alone on the dock, out in the lake with the family in the canoe. And the mental communication, the message is, this drug will make you less alone and lonely. And then, of course, you don't even listen to all the horrible things that the drug is going to do to you in the rapid, fast-paced, legally driven script at the end. It's a very peculiar piece of propaganda art, and I would love to understand more about how it's made to work. But the ads that I really want to talk about are other ads, and that has to do with Big Pharma's role funding dark money political pressure and ads. Pharmaceutical and health product companies put over $372 million into lobbying Congress and federal agencies in 2022, $1/3 of $1 billion. They deployed over 1,600 lobbyists, 3 times the number of members of Congress. Now, it's hard to keep track of dark money spending compared to lobbying because that's the whole purpose of using dark money funding channels. But an investigation by Issue 1 showed pharma contributed more than $34.5 million to the House GOP-aligned dark money group American Action Network since 2010. $35 million is enough to get the attention of House Republican leadership, I think. In 2022 alone, pharma gave a record $7.5 million to American Action Network, which spent millions on advertising in 2022 opposing our drug pricing reform efforts, and specifically the ones that made it into the IRA. Pharma donates to the Koch and Trump-affiliated dark money organizations Americans for Prosperity, Americans for Tax Reform, and America First Policies. A summary by the Washington Post in 2021 was pretty good. Congress members who supported legislation to curb the cost of prescription drugs faced, and I'm quoting here, massive months-long advertising, lobbying, and political donation blitz undertaken by the pharmaceutical industry and its allies to kill a Democratic proposal to lower the cost of prescription drugs by empowering the federal government to negotiate their prices. And obviously, particularly the political donation blitz and the advertising blitz have a lot to do with putting those political ads up on TV, which I think are disconcerting to folks in America, because when it's your TV and there's a message coming into you across your TV, and it's paid for by a group with a name like Americans for Peace and Puppies and Prosperity, and you know perfectly well that there is no such group that provides any real service or any real product. They're just there to mask who's really trying to communicate with you. It's creepy as hell. And I think we need to fix that, and I would like to encourage all of you to do whatever you can to encourage the pharmaceutical industry to at least be transparent in its spending. Don't use Americans for Prosperity or some of these other front groups as intermediaries. If you really think this opinion that you're offering into people's living rooms is worth it, own it. And I'll leave it at that. Actually, let me ask Mr. Mitchell, what do you think are the sort of red flags that we should be looking at where anti-competitive use of the patent system is signaled as opposed to pro-innovation use of the patent system?
Well, anytime you have a drug like Humira that, as the chairman pointed out in his opening remarks, had 165 patents on it and I remember the day Senator Cornyn spoke to the chairman of Humira in a hearing and couldn't get a straight answer from him on how many patents there were on Humira. Those patents, which began to expire in Europe in 2018, led to prices in Europe that were 15% of the prices that we paid in this country until Humira competition finally hit the market last year. So look for the number of patents, look at what's happening abroad. Did they give away a little bit of the market in Europe in order to protect their market here from competitors? There are signs to look for.
Thank you very much.